I grew up playing soccer, basketball, baseball, golf, like anything with a ball, you name it, and it's been a big part of my life. And that has sort of been hampered by my back in the last couple of years. It takes away from that enjoyment. When I wasn't feeling it, it was fine and it was out of sight, out of mind. And then when my back would flare up, I couldn't enjoy life because I couldn't do those things that I found to be cathartic and de-stressing for me. The most recent flare-up I had was sort of the tipping point for me. I couldn't move without pain. It's sort of harrowing to think back on, but I would get up in the middle of the night to go to the bathroom. I'd get up from my desk chair and I would have searing pains down my leg. I would walk and it would feel like someone was trying to pull my hamstrings out of my legs. I'd be on a walk with friends, with my mom, and I'd say, I need to stop. Like I need to sit because I physically can't go anymore right now. I ran the Chicago Marathon. Like I couldn't believe that I couldn't walk around the block without saying, I can't do this. So when that happened, I knew that I needed to take some kind of different approach to this problem.
So I think just to describe his situation, he's unique in that he had a massive disc herniation. He has a disc herniation so big that it could cause something called cauda equina. And that means he could have bowel, bladder dysfunction, sexual dysfunction, permanent weakness. It was actually remarkable that he wasn't worse. His brother-in-law-to-be trained with us as a spine surgeon, and he actually referred him to me for the endoscopic approach. Where using cameras, especially in someone that's very young, that's an athlete, that wants to be active, it's a phenomenal way to address a disc herniation and to do nothing about creating instability or destabilizing the spine.
Being active is how I decompress. So when Dr. Singh and his team said 3 to 4 months, I was thinking spine surgery would be a year minimum. I said, I'm in. They explained the whole procedure to me, how it would work. They made it very non-medically inclined friendly. They explained it to me in layman's terms like I was 5, and it was an incredibly appealing option, not only because the recovery was shorter, but just the thought of less cuts, less instruments going into my back. It was a very, very appealing option.
The patients swear by it. It's a dramatic improvement. They leave the surgery center within 60 to 90 minutes after the procedure. They're back at work the next day. It's a huge difference maker. As far as recovery is concerned, it's very quick. I mean, Garrett's a great example. He does 1, 2, 3, 4 sessions of physical therapy, not weeks on end, and he goes back to his normal activity. He's up and back. I think he was back at work the next day after his procedure. So the recovery is very quick. The recovery actually is not limited by the procedure, but by the medical conditions that the patient may have. If they're really sick, if they're deconditioned, that kind of limits it. But in general, post-operatively, people are doing maybe 1 or 2 sessions of therapy up to 4 weeks, and then they're back to their full activities at that point.
I would tell someone that's going through what I was experiencing prior to surgery, do your due diligence, see different surgeons. I wouldn't tell anyone to go under the knife without considering all of their options, but if they were feeling like I felt, that they couldn't walk without pain, their shins were on fire, I couldn't enjoy life. I couldn't enjoy being with my family. I couldn't enjoy being with my friends because I was always scared of am I going to have another flare-up? Am I going to be able to get to where I need to go without pain? It's one of the best decisions I've made in my life to go through with this procedure and to have it done specifically by Dr. Singh and his team.